First time, the University of Utah plans to activate an extra medical helicopter and pre-position it for the eclipse.
Yeah, it's part of a major effort in Idaho and Wyoming to be ready for routine medical problems and even a large-scale disaster during an event that could draw hundreds of thousands of people. Science and nature specialist John Hollenhorst has more on emergency preparations.
All across Wyoming, they're getting ready for an invasion. And in Idaho, too, roads might be jammed, possibly for days.
And folks are going to have medical emergencies, so we got to be able to get to them.
Planners are bracing for up to 500,000 visitors just in eastern Idaho.
Roughly speaking, doubling the population for potentially 4 days.
At the regional hospital in Idaho Falls, they're banning staff vacations August 19th to 22nd.
We've never done that before, to my knowledge.
Across the Teton Mountains in Wyoming, they decided not to schedule clinic appointments on August 21st.
We are bringing in the staff from all of those clinics to be on hand should we need extra doctors, nurses, and other professionals.
Monday, August 21st, the Great American Eclipse. That morning, the moon's shadow will race across the country. In a narrow band that slices through Idaho and Wyoming, people will see a total solar eclipse. In Utah, where it's only a partial eclipse, thousands may drive north. Idaho Falls Fire Chief Dave Hanneman is Eclipse Incident Commander in eastern Idaho.
We've never really planned for something this big as a real event happening.
The hospital in Jackson is working with the University of Utah to activate a spare AirMed helicopter. It will be pre-positioned in Jackson with extra staff to fly round the clock if necessary.
We want to be able to get to patients in the field to get them to care, but also if it becomes necessary to move them onto a larger care center for more definitive treatment. We want to be able to get them there quickly and safely.
One of the things that especially haunts some of the planners is the possibility that thousands of people from other states will flood into remote areas and high elevation places with no experience or know-how about the various risks.
Conduct around wildlife they may not be familiar with. Fire safety they may not be familiar with.
In addition to risks like snake bite and altitude sickness, there's all the routine medical emergencies, except way more than normal.
I'd say we're worried because it's not something we have history around.
Right after the eclipse, a sprawling traffic jam is expected on I-15 southbound from Idaho Falls.
We think the interstate is going to be bumper to bumper, and if that's the case, August 21st is going to be very hot.
With so much potential for medical problems, ambulances will be pre-positioned along the freeway. 2 extra medical helicopters will be pre-positioned in eastern Idaho, and there's even a contingency plan to set up a triage tent outside on the grounds of the regional hospital.
That is not for sure. That will only be if patient load requires.
It might be a once-in-a-lifetime experience for eclipse watchers, but it could be a real test for medical responders. John Hollenhorst, KSL 5 News, in the Wyoming-Idaho zone of totality.
John, thanks.